Okay, everybody, we're going to go ahead and start. First off, welcome and thank you for joining us. My name is Susan Kremen and I'm the Director of Marketing with Tech Service Today. I would like to introduce you to our speakers, Travis Taylor and William Hull, who will take you through the best practices for IT rollouts in home health and hospice care. Travis has over 4 years experience helping the healthcare industry efficiently and effectively deploy network infrastructure, access control, Wi-Fi, software, network and telecom cabling and equipment, and other low voltage projects and network security across the U.S. and Canada. William is the VP of Business Development at Tech Service Today and brings over 20 years of project management experience in a variety of industries, including IT infrastructure, healthcare, restaurants, hospitality, retail, and performance improvement. William holds a master's certificate in project management from the George Washington School of Business. And I'm going to hand it over to Will.
Thanks, Sue, and thanks everybody for attending today. We appreciate your time. Travis and I are going to take about 20 to 25 minutes to get through a few slides, and then we'll open it up for questions at the end. Everybody is muted at the moment. We'll unmute you at the end. You can use the questions section on your toolbar or chat if you want to throw some questions. In the meantime, we might answer them in the middle or we might wait till the end, just depending on what the question is. So we certainly welcome your questions. So again, we're going to keep this entire thing to 30 minutes because we know your time is valuable. So thanks for joining us. So we want to start at the beginning. And in any kind of project, the place to start, of course, is with planning. It's important that you not wait until the last minute to start planning, particularly where the boots are going to hit the ground, whether it's a new equipment rollout, an operating system, or other kind of software upgrade where you require people in the field, perhaps a Wi-Fi swap out or installation. Sometimes in big IT rollout projects, the actual nuts and bolts of what's going to happen when you actually put people out at your clinics, at your nurses' offices, whatever it might be, too often that gets not considered at the front end. And we do scores of these projects every year for healthcare, hospice companies, and too often people come to us not having really thought through everything. And the sooner in the process that you think about it, the better you're at with the project. I'm going to share with you a slide that if you've ever taken a course in project management, you've probably seen before. It's probably one of the first slides or diagrams you saw. And this is a classic diagram which talks about the relationship between the control you have over a project and the cost of that project. On this graph, you can see the orange line depicts the amount of control you have during the project, and the green line represents your costs. And this is a timeline that goes from left at the beginning of the project to the right at the end of the project. And as you can see, at the beginning of the project, you have a lot of control because you haven't done anything yet. As time goes on, your amount of control decreases because the decisions that you make constrain what happens in the future. On the other hand, the costs of the project are zero to begin with, and then as you make decisions, as you start expending resources, rolling out the project, the costs go up and they only go up. So the point of this is that you need to plan at the very beginning, because what you decide at the beginning is going to determine significantly whether your project is going to deliver the full scope within the designated schedule that your stakeholders have set for you and within the budget that you've set. And of course, in the ideal world, you're going to give the users even more than they were expecting in less time at less money. And the only way to do that is by planning in advance. And again, it's critical that at the beginning of the project, you're thinking about how are you going to roll this out? How are you going to put the boots on the ground to make this project work? Now I'm going to turn this over to Travis, who's going to talk about the importance of your instructions and your installation documents. Okay, take it away, Travis. And cut. Did that sound okay?
Yeah, yeah, no, that sounded good.
Okay.
So actually, my beginning wasn't that great, but it'll be fine.
Do you want to do it again?
You know what? Just to be safe, I forgot to turn my sounds off for everything. So so that's something that I like to do. I'm not very good with seeing on the track.
I didn't hear anything.
Okay.
It sounded fine to me.
Okay, if you think it sounds fine, then we probably don't need to. I'm sure it's good.
I think it sounded fine. And and to
Okay.
me, a little glitches, it just makes it sound real. I think if things sound overly scripted, they're not as it's just not as real. Real
Okay.
world is. So I'm going to go ahead and stop, and we'll call it a
All right.
wrap.